The future and results of VR show that this technology can be used almost everywhere. It breaks the rules of physics and crosses the line between fiction and reality, whether it's traveling through space or a paralyzed person walking for the first time after being paralyzed for years. When used in medicine, virtual reality changes traditional care by making the impossible possible. VR helps with clinical training, disease prediction, and disease prevention. It also helps prevent mistakes in treatment or diagnosis, which makes care more efficient. Virtual reality has a lot of benefits for medicine and the healthcare business. Let's look at the most important ones. However, before we begin our countdown, we would greatly appreciate it if you would subscribe to our YouTube channel and also press the bell icon. Let's get started. Number 10. Mental health treatment. Mental disorders are bad for your health and can sometimes even cause you to become disabled. The World Health Organization says that every fourth person will have a mental or nervous disorder in the future. Virtual reality training for doctors can help treat mental illnesses like a fear of crowds, split personalities, paranoia, insomnia, etc. Projects like Mimers really do work and provide good medical services to help fight phobias and reduce stress. Patients can fight their fears and forget about the pain by watching a 360-degree video from Limbics. People all over the world will benefit greatly from these kinds of medical virtual reality apps for the mass market. Number 9. Distraction from pain. Our subconscious mind is a very powerful tool that can make us completely change how we think, how our bodies work, and how we see the world around us. Unfortunately, we don't know much about this tool, but virtual reality in medicine can help. Drug treatment can be replaced with the help of audio and video effects. One example of this way of thinking is the Snow World mobile app, which helps fire victims stop thinking about their burns. Other apps, like Samsung Gear VR, help people forget about the pain or fear of the procedures. By fooling the brain, virtual reality devices can help relieve pain. Number 8. Healthy lifestyle promotion. People always have problems like harmful addictions, being overweight, not moving around much, etc. Medical VR technologies can help change a person's mind by showing him or her, through pictures or changes, what will happen if he or she makes a certain choice. Solutions that use VR will help people see the benefits of a healthy lifestyle and figure out how long it will take to get rid of bad habits. With the VR Health Exercise Tracker app, users can keep track of their heart rate, burn calories, and improve their metabolism by working out. It's not easy to stop smoking, but apps like Smoke Free and Quit Now can help smokers stay motivated and in control as they try to kick the habit. Number 7. Battling motor skill disorders. Virtual reality research in the field of motor skill disorders already shows how useful virtual reality devices can be. Relearning how to move is a long, hard process. The impact of VR will help people get more motivated, improve their sense of touch, improve their balance, and so on. This technology also helps make Parkinson's disease better to treat. People use the Nintendo Wii and Xbox Kinect to sharpen their senses, improve their motor skills, and improve their ability to deal with obstacles. This effect makes it possible to speed up both mental and physical processes, which makes it much easier for patients to fight the disease. Number 6. Helping patients with dementia and detecting early Alzheimer's. Alzheimer's disease affects millions of people, and this number is continually growing. It shows up in speech, how people interact with their environment, and memory. Using VR in medicine to diagnose a disease already helps relieve its symptoms and can make people feel better by taking them to exotic places, showing them animals, etc. Projects like the Wayback give people an alternative to drugs that can bring back important memories and feelings and help them talk to their loved ones. But VR medical training isn't just used to make Alzheimer's patients' lives easier. It can also be used to help find a cure. Medical virtual reality testing shows the risk of getting a disease at the age of 18. This helps scientists learn more about how the disease develops and how to stop it. Number 5. Patient informing and consulting. Not enough specialists, long waits for appointments, and not being able to see a doctor. All of these problems can be solved by using VR in healthcare. Technologies like telemedicine and VESI holomedicine help connect doctors and patients in a virtual way. Telemedicine lets you talk to a doctor online at any time, and in an emergency, it can speed up the process of getting a patient accepted by a doctor. Holomedicine from VESI helps patients understand their illness, the results of surgeries, and their next steps in treatment. Number 4. Surgical planning. Using virtual reality and augmented reality, surgeons can get a model of the part of the body that was operated on in 3 dimensions. This lets doctors look at medical cases from different points of view and think about the best way to operate. This makes surgery and health outcomes more likely to go well. AR VR-based platforms like Senti AR and Proximie help surgeons scan the body in real time, find problems, examine them in 360 degrees or in real size, and figure out the best way to do invasive procedures. Number 3. Improving dentistry. Dentistry is another field where virtual reality can help both new and experienced professionals improve their skills and learn to use new tools. Using VR equipment, they can look at 3D models and textures of teeth, jaws, and the mouth. Mood's haptic technology is a great example of a virtual simulator that surgeons can use. This virtual environment offers the most realistic modeling of dental processes, problems, and ways to treat them. Number 2. Enhancing surgery. Most of the time, medical virtual reality is used in surgery. It's hard to think of another area of medicine where imaging and the ways doctors can act in the real world would be more important. No, dummies don't have the same level of plausibility as virtual reality apps for mobile phones. Nothing will put real patients in danger because interns will be able to learn how to do complicated and subtle procedures. This will improve accuracy, reduce the chance of making mistakes, and lower the risk of complications after surgery. Also, sometimes a treatment needs to be done in a way that isn't very common and that most doctors may never see. And virtual simulators can make up for the lack of real-world experience. Also, VR helps doctors get better at surgery and trains them to use robotic surgery systems. Number 1. Immersive medical education. With virtual reality technology, medical students no longer have to cut up dead people to learn and practice. Future doctors can get better at their jobs by taking a virtual trip through the human body and learning from the mistakes of others without putting real patients at risk. Students can learn how to use different medical tools or technologies in a safe, controlled virtual environment using 3D models or virtual presence during operations. Human Sim, for example, offers different options for virtual reality medical training that help people learn the skills they need to do different tasks and processes. These apps give students information in a fun and useful way that lets them make their own medical simulations. After all, students will become better therapists the more they learn about how the body works. That's it for today. We hope you found our video interesting. If you did, please give it a big thumbs up and share it with others. Also, if you haven't already, please consider subscribing to our channel. Don't forget to turn on the notification bell so you don't miss any of our new uploads. In the end, thanks for watching and see you next time.